Oh, this is damage control right now. This is where you send people so that they're not seen to be dying in the streets. But the next step is refrigerator trucks.
I will do what I believe is right. And right now we need to save lives. If you don't think that COVID's real, right now you're an idiot. You need to understand that we're all in this together. You cannot fail to understand this. Stay apart. So I'm the guy who has to tell you to stay apart at Christmas and in the holiday season you celebrate, with your faith or without your faith, that you celebrate normally with friends and with family, that where you share memories and build memories. I'm that guy. And I'll say that because it will keep you safe. I'm the guy who's stealing Christmas to keep you safe. Because you need to do this now. You need to do the right thing. Because next year we'll have lots to celebrate. And we'll celebrate this year if we do the right thing this year.
Hey, there is an enormous demonstration going on at Stanford Hospital right now, carried out by staff who are protesting the decision by higher-ups to give vaccines to some administrators and physicians who are at home and not in contact with patients instead of frontline workers. Okay, so this is bullshit for a ton of reasons. First of all, you can't catch the virus from a Zoom meeting. The worst case scenario, you can see a coworker jerking off. So this is amazing that they're doing this. They're giving it to the elite first before they give it to the frontline workers. And you see the people there. Do you see this? They're not happy with it. This is a big demonstration happening at Stanford. I stand with Stanford House staff and other frontline workers who have been working 60 to 80 hours a week in the ICU emergency room and COVID units for the past 10 months. Transparency is the key to vaccine distribution.
No, don't you?
Guess we need everybody watching now.
I know, but that's okay.
We owe you big. We really do. And one of the things is that I think that the administration deserves some credit getting this off the ground with Operation Warp Speed.
Announcement today.
By giving you an honest assessment of where we stand today in Ontario. We saw this morning's modeling that our COVID-19 numbers continue to accelerating at an alarming rate. Unfortunately, despite the restrictions, we've seen growing numbers of people traveling between regions within Ontario. COVID is spreading rapidly from high outbreak areas to areas with fewer cases. As it does, our hospitals are filling up more each day. We've seen a 70% increase in hospitalizations and 80% increase in ICU admissions in the past few weeks. Remember, 75% of our intensive care unit beds at any given time are taken up by people who have had car accidents or heart attacks or other emergencies. My friends, above all, we need to preserve capacity in our ICUs and our hospitals. But because of increased cases of COVID-19 filling up our hospitals, we're on the verge of canceling more elective surgeries. And we already have thousands and thousands of backlog surgeries. We've seen in other jurisdictions what out of control caseloads and deaths look like. And I am also extremely alarmed by reports of a new strain of COVID-19 that is much more contagious than what we've seen and what we've been facing so far. This is an extremely serious threat, one we must take seriously. We need to ensure that our border is secure. We need to be certain that we're catching cases of COVID before they have a chance of spreading in our communities. Otherwise, the sacrifices we're once again asking Ontarians to make, they're for nothing. That's why we have continually, and we're going to repeat this, continually asked the federal government to secure our borders. 63,000 people are going unchecked every week just through Pearson International Airport. And I can tell you, if they won't act further, at minimum, we need to test air travelers when they arrive at the airport. This is critical. And if they don't do it, we will do it ourselves if needed. The vaccine has started to trickle in, but due to limits in supply, it will be months before we have mass immunization. If we fail to take action now, the consequences could be catastrophic. We're asking all Ontarians to stay at home and only leave when absolutely necessary, such as work, groceries, prescriptions, or medical appointments. Essential businesses such as grocery stores and pharmacies will remain open at reduced capacity. Other retailers will be open for curbside pickup and deliveries only. The restrictions will be made in place for a period of 14 days in Northern Ontario and for a period of 28 days in Southern Ontario.
Now, more on the COVID-19 outbreak at Joyceville Institution in Kingston, Ontario. At least 80 inmates have tested positive. There are now also 8 cases at 2 other prisons linked to Joyceville, all in-person visits at Ontario Correctional.
I thought it wasn't real. Like, there's no way this could be real. I was driving home. I'm like, there's something wrong. There has to be something wrong with the situation. Like, how is this happening to me?
Last week, Jessica Reichel experienced her own Christmas miracle.
And then I look at the slip, and that's what I see, what they did for me. And in that moment, I kind of blacked out, if I'm being completely honest.
After being tipped $1,000 by a couple she had never met before.
And I said, like, no, stop, has to be a mistake. Like, it has to be. And they're like, no, it's not a mistake. We told you we're going to help you out. And they walked out the door.
Reichel wasn't the only one surprised by the giant gesture of generosity.
First, I thought perhaps it was an error, that the guest had maybe hit the decimal point in the wrong place.
This act of generosity was a shock, seeing as the customers only ordered $82 worth of nachos, beers, and wings.
And we were able to contact the guests who wished to remain anonymous, and we completely respect that. And they said, yes, absolutely. This is what we wanted to do, to spread some Christmas cheer.
Reichel admits it's been a tough year, saying after focusing on paying rent and car payments and other essentials, there was almost nothing left to pay for Christmas gifts.
At that moment, I just had to do what I had to do because it's my son, my daughter and my grandson in the middle to the drama.
That drama all played out on surveillance video from Panchita's Pupuseria the day after Thanksgiving. You can see this customer walks in, and after learning her order would take a little longer than expected,
we told her 15 minutes and it took about 20 minutes.
What happened next gives a whole new meaning to the term hangry.
She grabbed a jug of like a 5-pound hand sanitizer and launched it at me while I was holding my son.
That's when owner and nearly 60-year-old Grandma Doris grabs whatever she can, including this table, to defend her family and her more than 30-year-old business. Operating a small business is challenging enough as it is with the ever-changing restrictions. Some small eateries are now forced to make concessions, all to keep customers happy.
For example, if somebody wants to order a bottle of wine to go, we're offering a 20% discount.
Not all restaurants, though, can afford to make these concessions.
Really just ask everyone to please be understanding that, we're not doing this for fun. Most people are trying to pay the bills and pay their employees and pay the health insurance and pay the taxes without much financial relief.
As for what happened at Panchita's, the woman eventually left the restaurant and thankfully no one was hurt. San Francisco police say the investigation is ongoing. Doris is speaking out in hopes of identifying the woman and holding her accountable.
Bad behavior is one of the things we don't forecast for.
She has this message for the community that has been so good to her family for so many years.
Being considerate of the employees, considerate of the business, and just having some empathy for the industry itself. We are trying to stay afloat for the community and for ourselves.
Dr. Marklin is with us this morning. He's an intensive care physician with the Royal Alexandra Hospital, and he is in Edmonton today. Dr. Marklin, thank you for being our guest once again.
Yeah, it's a pleasure.
You were listening to John's reporting and bringing forward some of the details in those internal documents CBC News accessed. What is your overall view of the plan the province is now considering?
Madness. So Dr. Gibney's assessment is absolutely correct. One of the things that really concerns me is that it completely negates the forecasted admissions, which are still exponential this far out after the limited restrictions that the government has put in. Even if we do get these field hospitals, and if we miraculously find field workers, which we're talking about using the military, which anyone who's ever received a suppository will be very nervous to have Lance Corporal, artillery master putting a shell up their bum. These are complex systems that interact with complex people. And so when you suddenly disrupt a system that works with a new system, you find mistakes happen. And mistakes with critically ill patients lead to death. This is a half-hashed solution, which could have been prevented over a month ago with appropriate lockdown.
Okay, hold on to that last thought. But back on the staffing point, again, yes, considering bringing in military to staff as the plan indicates, but you're not surely suggesting that military are going to be doing medical duties in this scenario.
Well, if they're not doing medical duties, I don't know who's going to be doing them. We have literally in our unit recalled nurses from all other areas that could provide care, and we're pulling some out of retirement. The well is pretty close to dry for experienced staff. So then you look at distributing less complex tasks, but in an ICU, there aren't a lot of less complex tasks.
All right, that is a good point. So in the staffing thing is this piece is a very big question of all of this. Do you see, or how do you see it working? Is there any scenario where you think these 4 field hospitals could be of benefit?
The only thing that I think could possibly work is using them as a way to decant the non-acute patients who are in hospital beds right now. And in that situation, that works. There are people who are always better just waiting for long-term care or need enhanced care measures. And that could be done with military assistants and LPNs and care workers.
I want to come back to your assessment overall, because the province, the Premier, and Alberta Health Services, they have said this is a responsible approach, looking at the numbers and the trending. Alberta Health Services calling it part of the ongoing proactive planning. That's their view. Is it, or is it an admission of failure to you?
Well, this is damage control right now. This is where you send people so that they're not seen to be dying in the streets. But the next step is refrigerator trucks.
That dire?
Yes, it's that dire. When you overwhelm a hospital, you don't stop the regular sick people from coming in. They're still coming in. And when Christmas passes, we're going to see a wave of mental health disorders, which typically happens after Christmas. We see a lot of suicides, we see a lot of overdoses, and we're going to have to deal with that, I think, in spades this year, because mental health has been suffering more than ever.
How quickly are we spiraling down there in Alberta? Because we were speaking to you just about a week ago, just over a week ago. Are things worse even compared to that conversation?
Oh, much worse. There is another intensive care physician who's literally running around the hospital trying to manage the consults so the rest of us can get our work done. We have now brought in anesthesia to do a lot of the procedures so that we can do the cognitive work. We're recalling nurses. We're getting by because we have exceptional support staff, but our give in the system is almost exhausted. And then the next step will be going into our recovery rooms and shutting down surgeries. That's in the case of a week. Next week, I try not to think too far in the future.
I'm going to get you to do so in just a second. We're also hearing about double bunking in ICU, also hearing about requests, I don't think it's demands yet, but requests to conserve oxygen. Are these all things that you're having to contend with as well?
Oh yeah, no, we are double bunking, putting 2 patients in a room, which is something that we haven't had to do since 2009 when we had the H1N1 pandemic. it's substandard care, because the reason why you have individual ICU rooms is to prevent the spread of other organisms that can then spread through your hospital, and also to provide really good care. When you have more than one person in a room, your chance of someone becoming delirious skyrockets, and delirium has significant mortality and delays people transitioning out of your ICU. With respect to oxygen, no, we specifically don't have that problem, but some hospitals have been, and that's just, they have enough oxygen, their plumbing is just insufficient to send the volumes to the places it has to be. And there are workarounds for that, but it's a sign of the stress on the system.
So the numbers so far, 504 in hospital right now in the province, 97 in ICUs in the province. You say you don't like to look to the future, but I'd like you to do that for just a moment. If not field hospitals, what's the way out?
Immediately, there isn't one. We have a surge plan. We will take over the ORs. We will shut down everything but emergency surgeries. And then if we spill past that, then we start the triage councils, which means picking who lives and dies based on their survivability and their comorbidities. And that's a pretty brutal prospect. We have to shut down. We have to stop this. There will be a vaccine. We can get through it. We can budget how much it costs to do this. There is a foreseeable end. We just have to accept the fact that this needs to be done. There are no other solutions. This is the law of nature. And no matter how much you believe in the economy, the law of nature will always win.
Dr. Darren Marklin, thank you. That's a pretty chilling depiction of what you're dealing with there in the province. Appreciate your time this morning from Edmonton.
London is back in lockdown as the UK fights a new strain of the virus. Over the weekend, train station and airports in the United Kingdom were packed with people trying to get out before travel bans took effect. Now more than a dozen countries have banned travel to and from the UK. James Longman is in London with more.
Britain is sounding the alarm this morning over a new variant of COVID-19. Prime Minister Boris Johnson with an emergency address to the nation.
As Prime Minister, it's my duty to take difficult decisions, to do what is right to protect the people of this country.
He had promised the UK would be back to normal in time for Christmas, but now much of Britain, including London, is locking down for the holidays. For 21 million people, only essential businesses remain open. Scientists say the new variant spreads up to 70% faster than the original virus. Importantly, health experts warn mutations of any virus are expected, and there's nothing to suggest this is more deadly. But an increase in spread does threaten health services. Scientists have been aware of the new variant for some time, but Johnson's announcement triggered a rush out of the capital, jamming train stations and highways. Britain is slowly being sealed off. Belgium, Italy and the Netherlands among those banning travel. Overnight, Canada restricted inbound flights from the UK. The French suspension has even shut down the Eurotunnel and the UK's main port, threatening food supplies. Now, New York Governor Andrew Cuomo is calling for similar action in the United States.
Right now, this variant in the UK is getting on a plane and flying to JFK today. 120 countries demand that before you get on a flight in the UK to come to their country, you have to have tested negative. The United States does not require it. This is reprehensible because this is what happened in the spring.
New York airports have on average 6 flights coming from London every day.
And a look at Ottawa this hour. So Canada is the latest country to ban flights from Britain over concerns about a COVID-19 mutation that's spreading in southeastern England. The temporary move comes after Prime Minister Justin Trudeau took advice from the Incident Response Group. That's an inner circle of cabinet ministers and officials that includes Health Minister Patty Hajdu, Transport Minister Mark Garneau, and Canada's top doctor, Theresa Tam. No cases linked to this new strain have been identified in Canada, but in a statement, the government says it is implementing measures to allow further time to investigate the issue. The statement goes on to say these include a 72-hour suspension of all commercial and private passenger flights from the United Kingdom, effective midnight, and secondary screening of all travelers who arrived in Canada from the United Kingdom in the last day, covering the period Saturday into Sunday. we're watching for further possible international action this morning. The European Council, representing the EU's 27 nations, are meeting in Brussels right now as the list of countries issuing their own travel bans on Britain grows. Dominic Velitis is in Bristol, England, tracking all the developments for us. So Dominic, you know, the UK, it's effectively isolated from the rest of the world right now because of this new strain. What is the latest?
Well, as you say, Ash, EU member states are meeting right now to discuss how to respond collectively to this new variant of coronavirus, which Britain's Health Secretary Matt Hancock said yesterday was out of control and responsible for a surge of cases in parts of England. An EU-wide coordinated response is on the table. What that may be exactly, if it has any further impact on travel to and from the UK, we'll have to wait and see. But certainly several European countries, including France, Germany and Italy, have already announced temporary bans on flights from the United Kingdom. Countries from beyond the European Union's borders have also introduced new restrictions on UK travel. Asha, Turkey and Switzerland have halted flights. Others like Israel, Iran, Argentina, Morocco and Kuwait are all introducing restrictions as well. In all, Asha, more than 20 countries have taken action now or on the verge of taking action, a measure, I think, of the alarm that is growing about this new strain of coronavirus. Asha.
You mentioned alarm, but there's also a particular concern in Britain over the French stance on this issue. The government in Paris has gone one step further, right?
Yeah, that's right, it has. It's suspended all travel links to the UK, including freight trucks, for a period of 48 hours. Now, the port of Dover, which is on Britain's south coast and sees about 10,000 trucks pass through every single day, is now closed to outbound traffic. Although freight coming in from France will be allowed, there are fears that drivers just won't make that trip in case they get stuck here in the United Kingdom. They have been advised to find other routes back into the continent, but that will be financially unviable for many. The authorities, Asha, are warning of serious traffic disruption in and around the port in the coming hours and days. Retailers, meanwhile, say we could see potential shortages of fresh foods as a result.
You said recently that the virus was under control.
Yes.
Is it?
No, it's not. The new variant is out of control and we need to bring it under control. And this news about the new variant has been an incredibly difficult end to, frankly, an awful year. And it's important for everybody to act, essentially act like they might have the virus. And that's the way that we can control it together.
The cases in the Tier 4 areas, as you've seen from the graphs that have been presented, have absolutely rocketed in the last few days, last 2 weeks or so. And so we've got a long way to go to sort this. Essentially, we've got to get that vaccine rolled out to keep people safe.
To prepare ourselves, I mean, is it likely that if you're in a Tier 4 area now, you're going to be in a Tier 4 area until that vaccine is rolled out?
Well, I think that given how much faster this new variant spreads, it is going to be very difficult to keep it under control until we have the vaccine rolled out.
This is one of the parts of Toronto hardest hit by COVID-19.
Every day I'm seeing someone else with a really severe illness from COVID.
Dr. Martin Betts heads the critical care team at the Scarborough Health Network.
At least on 3 occasions during the pandemic, we've cared for multiple family members simultaneously in our intensive care unit.
A CBC News analysis shows nearly half the total number of patients in Scarborough's intensive care units are now battling the illness. That's a stark contrast from the rest of Toronto's hospitals, where fewer than 1 in 5 ICU patients have the disease. Physicians say it isn't so much that patients here are less healthy, but that many are essential workers living in multi-generational homes.
We are tired of getting the scrap that come from every level of government.
All of it makes Scarborough a case study for other communities.
And we know we're not out of the woods yet.
For Betts, who has watched family after family torn apart, the end can't come soon enough.
This was a brand new Terry production 2020.